A comparison of healthcare between the US, Ohio, and Iceland. Types of healthcare system. The US and Ohio both have the exact same healthcare system of private insurance. This includes individual private insurance, employment-based group private insurance, and government insurance such as Medicare and Medicaid. On the other hand, Iceland has universal insurance. The health service is controlled and funded by the central government, which collects money for health services through taxation. Every citizen is entitled to some degree of medical coverage, despite the size of his or her contribution to the health service. The individuals of Iceland actually have an increased tax of 80 to 85% just so they can cover the bottom dollar. Population health. Life expectancy from birth to death for men, women, and overall. Life expectancy at birth is defined as how long on average a newborn is expected to live without the change in death rates. This can be a little bit hard to predict because of the variables of everyday living. Out of the 36 member countries of the Organization of Economic Cooperation and Development, the US ranks at 26. This means that men are expected to live at least 76.3 years, and women are expected to live at least 81.2 years. In Ohio, it's a little bit decreased, with men at 75.2 and women at 80.2. In Iceland, they have a very long life expectancy, and they're actually ranked 7th in the world. The men are expected to live 81.2 years, which is longer than any other Western European country. And women are expected to live 83.8 years, which is 6th in the Western European countries. Healthcare spending. Out-of-pocket healthcare spending. Because Ohio is private-based insurance, we pay a premium on each paycheck, so the health insurance will actually pay for at least 75% of our healthcare coverage. Once our deductible is up, we have to pay the rest out of pocket, and that will be at least 11%. Iceland, on the other hand, has universal coverage, so their government will pay at least 81% of their healthcare costs. This will include surgeries, daily checkups, and other healthcare needs, except for dental and pharmaceuticals. That is the 18% that comes out of pocket. Healthcare system. Number of preventable deaths prior to age 75 per 100,000. In the US, we are plagued with at least 5 top diseases that are preventable. They are cancer, heart disease, respiratory disease, stroke, and accidents. Per 100,000, heart disease comes in at 167.0, cancer is at 161.2, respiratory 40.5, strokes 36.5, and accidents come in at 40.5. In Ohio, I could not find the per 100,000, but I do have the totals for 2015. Heart disease comes in at 5,305, cancer at 4,127, strokes are at 752, and respiratory disease is at 2,093. Now this graph over here shows the Icelandic preventable deaths per 100,000 starting from 2011 all the way to 2015. It does fluctuate pretty recently from 2011 through 2015, but it ends at 447 deaths in 2015. Cigarette consumption. Now this isn't an actual slide, I just found it very interesting. The US and Iceland are very similar on the amount of cigarettes consumed per year. In Iceland it is 848, and in the US it is 1,017. In Iceland, 17% of men smoke, 15.1% females, and for children ages 10 to 14 years, it is 1.48% and 2.74% respectively. Now in the US, it's a little bit increased because it is a larger country, Males are 19.5%, females are relatively the same at 15%, and children from 10 to 14 are 1.34% and 1.17% respectively. Now, because the numbers of cigarette consumption are increasing, each area has its own tobacco control efforts. Each one is pretty similar. They all have an age band. In the US, it is 18, 19, or 21. In Ohio, it is 18, and also in Iceland, it is 18. In the US, there is an advertising ban, so they cannot advertise on radio or TV, and it is only smoke-free in government buildings. Now, in Ohio, it is smoke-free in all public areas, and there is a sales tax of at least 30%. Now, in Iceland, it is also smoke-free in all public areas. They do have an advertising ban, but they also must have a warning label on each package that covers at least 40% of it. Physical environment, air quality. The Air Quality Health Index is a scale designed to help you understand what the air quality around you means to your health. The higher the number, the greater the health risk associated with air quality. Now, in the US, it ranges from either very good to unhealthy for sensitive groups. The lowest rating I noticed was in Columbus, Indiana, with a score of 2. Now, the highest I noticed this morning was in Southern California near Los Angeles with an elevated score of 105. Now, in Ohio, in Cleveland, where I live, at 10 a.m. this morning, the air quality was about 86, which was kind of moderate. Now, in Iceland, due to an oceanic climate with steady winds, the air quality is relatively good. At 1400 Icelandic time, when I looked this morning, in the capital city, Reykjavik, it was 4. Access to care. Primary care and specialty care physicians per 100,000. In the US, primary care is 134.3, specialty care is 148.3. Now, total, there is some duplication, but the total would be 223.9 per 100,000. In Ohio, the primary care is 148.8, specialty care is 174.4, and total it is 218.8 per 100,000. This is 22nd in the US. In Iceland, it actually increased from 2012. It was 355.8 physicians per 100,000, and as of 2015, it is 380 per 100,000. Social and economic environment, violent crime rates. In 2016, in the United States, we had 17,250 homicidal counts. That brought it to 5.3 per 100,000. Now, in Ohio, there were 654 homicidal counts. That brought it to 5.6 per 100,000. I broke it up down just a little bit further, and in Columbus, Ohio, the homicidal count was 91. This brought it to 10.6 per 100,000. Now, in Iceland, there is a big decrease at the homicidal count of 3. This brought it to 0.9 per 100,000. Kind of makes you want to live in Iceland. Conclusion. America is a great country, even though we do not have free healthcare just yet. Even though we are one of the top economic powers in the world. Iceland is one of the healthiest countries in the world. It has the lowest pollution, high life expectancy, and extremely low rate of infant mortality. The health service is well organized, it's progressive, and has way more doctors per head of population than any other country. There is no private health sector in Iceland, and all citizens, regardless of status, are delivered healthcare services.